Question 1. A patient is admitted for chemotherapy to treat adenocarcinoma of the lung. What is the correct sequencing for the principal diagnosis? I. Z5111, C3490. B. C3490, Z5111. C. C3490, Z510. D. J98 4, C3490. Answer I. Z5111, C3490. This question tests the ICD-10-CM guideline for sequencing when the encounter is solely for chemotherapy treatment. The keyword chemotherapy indicates that the reason for the encounter is the treatment itself, not the active tumor management. When the patient receives only chemotherapy, the appropriate Z code, Z5111, encounter for antineoplastic chemotherapy, is sequenced as the principal diagnosis. The code for the malignancy, C3490, malignant neoplasm of unspecified part of unspecified bronchus or lung, is then listed as a secondary diagnosis, even though the cancer is active. Remember this critical exception. If the patient is seen only for radiation or chemotherapy, the Z code is always primary. Question 2. A 68-year-old established patient presents for a well-woman exam, preventive care. During the encounter, the physician discovers a new, unrelated condition, hypertension, which is addressed and managed during the visit. How should the services be reported? I. Report only the preventive medicine service, e.g., 99397. B. Report only the problem-oriented E/M service, e.g., 99213. C. Report both the preventive medicine code and the appropriate problem-oriented E/M code with modifier -25 on the E/M code. D. Report the preventive medicine code and the problem-oriented E/M code without any modifiers. Answer C. Report both the preventive medicine code and the appropriate problem-oriented E/M code with modifier -25 on the E/M code. This item tests the CPT and E/M guidelines for reporting a significant, separately identifiable evaluation and management service during a preventive visit. The keywords established patient, well-woman exam, preventive, and new, unrelated condition, addressed and managed are crucial clues. When a physician addresses a new or significant pre-existing problem during a preventive visit, both services can be reported. The CPT preventive code is billed first, and the problem-oriented E/M code, like 99213, must be appended with modifier -25 to indicate that a separate, significant E/M service occurred beyond the normal preventive service. A quick takeaway is to use modifier -25 whenever you report two E/M services for the same provider on the same day. Question 3. What is the CPT code for a total abdominal hysterectomy with bilateral salpingo-oophorectomy? I. 58,150. B. 58,260. C. 58,180. D. 58,550. Answer I. 58,150. This question tests basic knowledge of CPT surgical coding in the female reproductive system, specifically for an open abdominal approach. The procedure is a total abdominal hysterectomy, which is the removal of the uterus via an abdominal incision, and it includes the bilateral salpingo-oophorectomy, removal of both fallopian tubes and both ovaries as part of the total procedure code definition. Code 58150 describes the total abdominal hysterectomy, including the removal of tubes and/or ovaries. Pay close attention to the approach, abdominal, vaginal, or laparoscopy, and the extent of the procedure, total, subtotal, radical, when coding hysterectomies. Question 4. A patient falls down a flight of stairs at home. The patient is seen in the emergency department for a fractured tibia. What external cause code is required to specify the place of occurrence? I. Y9200. B. W10-2XXA. C. W10-9XXA. D. Y92030. Answer D. Y92030. This question tests the ICD-10-CM guidelines for external cause of morbidity codes, specifically the mandatory reporting of a place of occurrence code. The crucial keywords are falls down a flight of stairs, mechanism, W10, and at home, place. The place of occurrence code describes where the event happened, and for a private home, the correct category is Y92003, which then requires 3 characters for completeness, Y92030. Always remember that place of occurrence codes, Y92, must be reported in addition to the main external cause code, W00, Y09, to fully explain the injury circumstances. Question 5. The root word os/o primarily refers to which anatomical structure? I. Joint. B. Cartilage. C. Bone. D. Muscle. Answer C. Bone. This question tests essential medical terminology, specifically the meaning of a common Greek or Latin root word. The root os/o is the combining form universally used to refer to bone, a hard, dense connective tissue. For example, osteoporosis means porous bones, and osteoarthritis is inflammation of the bone and joint. Memorizing common prefixes, roots, and suffixes is a fundamental requirement for medical coding, as it allows for the clear and rapid understanding of complex diagnoses and procedures. Question 6. The healthcare provider documents a level of medical decision-making, MDM, that includes 2 unstable chronic illnesses, 3 new acute complicated problems, and a high risk of complications or morbidity/mortality. What is the overall level of MDM complexity? I. Low. B. Moderate. C. Straightforward. D. High. Answer D. High. This item tests the understanding of the 3 elements of medical decision-making, MDM, used to determine E/M service levels. The 3 elements are number and complexity of problems, amount and/or complexity of data, and risk of complications and/or morbidity or mortality. To qualify for a specific level, a provider must meet or exceed 2 of the 3 required elements for that level. The documentation mentions high complexity problems, unstable chronic illnesses, new acute complicated problems, and a high risk, instantly fulfilling 2 criteria for high complexity MDM, which dictates the highest E/M service level. Question 7. A patient had a bilateral mastectomy, CPT 19303, 1 week ago. Today, the patient returns to the operating room for a totally unrelated debridement of a traumatic skin laceration on the leg, CPT 11042. Which CPT modifier should be appended to the debridement code? 11042? I. -78. B. -58. C. -79. D. -24. Answer C. -79. This question tests the application of CPT modifiers related to the global surgical package. The key clue is that the second procedure, the debridement, is totally unrelated to the initial surgery, mastectomy, and occurs within the global period, typically 90 days for major surgery like 19,303. Modifier -79, unrelated procedure or service by the same physician or other qualified healthcare professional during the postoperative period, is the correct choice because it indicates the second surgery is not a complication or a planned staged procedure. Remember that modifier -79 guarantees payment for the new procedure, as it breaks the link to the original global fee. Question 8. A surgeon dictates exploratory laparotomy with incidental appendectomy. The appendectomy was performed because the appendix was healthy and easily accessible during the main required procedure, exploratory laparotomy. How should the appendectomy be coded? I. Code both procedures, using modifier -51 on the appendectomy. B. Code only the exploratory laparotomy. C. Code both procedures, using modifier -59 on the appendectomy. D. Code only the appendectomy. Answer B. Code only the exploratory laparotomy. This question focuses on the CPT separate procedure rule and the concept of incidental procedures. An incidental appendectomy, meaning one performed only because the structure is visible and easily accessible during a major procedure, is generally not reported separately. If the procedure is designated as a separate procedure in CPT and is performed with another more extensive procedure in the same area, it is considered bundled unless it meets an exception. When a healthy appendix is removed incidentally, only the main procedure, the exploratory laparotomy, is coded. Question 9. What term describes the study of disease cause or origin? I. Pathology. B. Etiology. C. Morbidity. D. Nosology. Answer B. Etiology. This question tests a foundational term in medical terminology, crucial for understanding and applying ICD-10-CM codes. Etiology is the scientific study of the causes or origins of a disease or pathological condition. For example, determining the etiology of an infection means identifying the specific bacterial or viral agent responsible. The ICD-10-CM code structure often requires coding the etiology, cause, first, followed by the manifestation, symptom, or condition, which is a key concept in coding guidelines. Question 10. According to CPT, what is the maximum number of days a physician's work can be included in the global surgical package for a major surgical procedure? I. 10 days. B. 30 days. C. 90 days. D. 180 days. Answer C. 90 days. This question tests knowledge of the CPT and CMS guidelines regarding the global surgical package period for major surgeries. A major surgery is typically assigned a 90-day global period, which begins the day after the surgery. This package includes all routine preoperative care, the day before or the day of surgery, the surgery itself, and all routine postoperative care related to the surgery for the next 90 days. Minor surgeries typically have a 10-day global period, so always distinguish between major and minor procedures when determining global periods. Question 11. What is the principal HIPAA title that governs security and privacy standards for healthcare information? I. Title I. Healthcare Access, Portability, and Renewability. B. Title II. Preventing Healthcare Fraud and Abuse, Administrative Simplification, Medical Liability Reform. C. Title III. Tax-related health provisions. D. Title IV. Application and enforcement of group health plan requirements. Answer B. Title II. Preventing healthcare fraud and abuse, Administrative Simplification, Medical Liability Reform. This question targets key compliance and regulatory knowledge, specifically the titles of the Health Insurance Portability and Accountability Act, HIPAA. Title II is the most relevant section for medical coders and billers, as it encompasses the administrative simplification provisions. These provisions mandate the security, privacy, and electronic transmission standards for protected health information, PHI, which is the basis for the HIPAA privacy and security rules. Understanding Title II is essential for ensuring compliance in a medical billing and coding setting. Question 12. Which ICD-10-CM code category is always a secondary diagnosis and describes a patient's personal history, genetic risk, or long-term drug use? I. V codes, external causes. B. G codes, diseases of the nervous system. C. Z codes, factors influencing health status and contact with health services. D. T codes, injury, poisoning, and certain other consequences of external causes. Answer C. Z codes, factors influencing health status and contact with health services. This question tests the application and appropriate sequencing of ICD-10-CM Z codes. Z codes are used in almost every healthcare setting and are required to describe circumstances other than a disease or injury, often detailing a patient's history, exposure, or reason for an encounter. Although some Z codes, like those for chemotherapy, can be primary codes for personal history, e.g., history of colon polyps, are always secondary, providing important context for a patient's current care. Learn to identify Z-code categories that describe history and status, as they are crucial for risk adjustment and care management documentation. Question 13. A patient is documented with chronic obstructive pulmonary disease, COD, with acute exacerbation. Which term is the manifestation, and which is the etiology, assuming no infection is documented? I. Etiology. COPD, manifestation. Acute exacerbation. B. Etiology. Acute exacerbation, manifestation. COPD. C. This condition requires a combination code. D. This condition requires sequencing the code for the exacerbation first. Answer C. This condition requires a combination code. This question tests the ICD-10-CM guideline for coding conditions with exacerbation. The keywords COPD with acute exacerbation indicate a single diagnosis that is fully captured by one code, which is known as a combination code. Combination codes are common for respiratory conditions, where a single code reports both the underlying chronic condition and the acute worsening, such as J44.1 for COPD with acute exacerbation. Always check the tabular list for a combination code when documentation links two conditions using terms like with, due to, or associated with. Question 14. Which structure of the heart is responsible for generating the initial electrical impulse, the natural pacemaker? I. Atrioventricular AV node. B. Purkinje fibers. C. Bundle of His. D. Sinoatrial say node. Answer D. Sinoatrial say node. This question tests fundamental cardiovascular anatomy and physiology, a required component of the coding exam. The keyword natural pacemaker immediately points to the sinoatrial say node, which is a small mass of specialized cells in the right atrium. The SA node automatically generates the electrical impulse that spreads through the atria, causing them to contract and initiating the normal heart rhythm. A strong foundation in anatomy helps coders understand complex procedures like pacemakers and electrophysiology studies. Question 15. The physician spends 45 minutes of a 60-minute face-to-face outpatient visit counseling the patient on managing their new diabetes diagnosis and coordinating care with a nutritionist. If counseling/coordination of care dominates the visit, how should the E/M code be selected? I. Based on the 45 minutes of counseling regardless of the other components. B. Based on the amount of medical decision-making, only. C. Based on the time only if it meets a pre-established threshold, G. 50% rule. D. Based on the history, exam, and MDM, since the patient is established. Answer I. Based on the 45 minutes of counseling regardless of the other components. This question tests the E/M guideline regarding time as the key component for code selection, specifically when counseling or coordination of care dominates the face-to-face encounter, more than 50% of the time. The crucial clue is that counseling dominates the visit and the total time is documented. When more than half of the face-to-face time is spent on counseling and/or coordination of care, the coder may use the total time of the encounter to select the appropriate E/M code, even for established patients. Ensure the documentation explicitly states the total time and the amount of time spent counseling to justify using time as the controlling factor. Question 16. What is the correct CPT code for a simple repair of a 40 cm laceration of the hand? I. 12,002. B. 12,032. C. 12,042. D. 13,132. Answer I. 12,002. This item tests the fundamental CPT guidelines for coding wound repair based on the complexity, location, and length. The keywords are simple repair, 40 cm, and hand. Simple repairs are coded using the 12001, 12007 series for the scalp, neck, axillae, external genitalia, trunk, and/or extremities, including the hand and foot. Since 40 cm falls within the size range of 26 cm to 75 cm for a simple repair of the hand, code 12002 is the correct choice. Always combine all lacerations of the same complexity and site group before looking up the final code. Question 17. The NCCI, National Correct Coding Initiative, edits defined code combinations that should not be reported together. What is the main function of an NCCI modifier indicator of 1. I. The codes are a component and a comprehensive code, and a modifier is never allowed. B. The codes are a component and a comprehensive code, and a modifier, like -59, is allowed under appropriate circumstances. C. The codes are mutually exclusive and can never be billed together. D. The codes are not an edit pair and are always separately payable. Answer B. The codes are a component and a comprehensive code, and a modifier, like -59, is allowed under appropriate circumstances. This question tests a key billing compliance concept related to the NCCI procedure-to-procedure (PTP) edits. An NCCI modifier indicator of 1 signifies that the two codes are generally considered bundled. The first code is a component of the second/comprehensive code. However, you can bypass the edit and report both codes separately only if the documentation clearly supports that the services were performed at different anatomical sites or during separate patient encounters. Therefore, a modifier, most commonly -59, is permitted to override the edit and indicate that the services were distinct. Question 18. A patient is diagnosed with an adverse effect of a correctly prescribed anti-inflammatory drug, causing acute tubular necrosis. How should the principal diagnosis be sequenced according to ICD-10-CM guidelines? I. Code for the anti-inflammatory drug, then the acute tubular necrosis. B. Code for the acute tubular necrosis, then the anti-inflammatory drug, T36, T50 category. C. Code the condition first, then code the type of drug causing the adverse effect. D. Code the condition first, then code the adverse effect, T36, T50 category. Answer B. Code for the acute tubular necrosis, then the anti-inflammatory drug, T36, T50 category. This question tests the ICD-10-CM guideline for sequencing an adverse effect of a correctly administered drug. The keyword adverse effect is key. For these cases, the nature of the adverse effect, the acute tubular necrosis, a manifestation code like N17-9, is always the principal diagnosis. This manifestation is followed by the appropriate T36, T50 category code, which identifies the drug causing the adverse reaction, in this case, an anti-inflammatory drug. This sequencing differs from poisonings or underdosing, so always confirm the cause and effect relationship in the documentation. Question 19. A radiologist performs a professional component service. Which CPT modifier is used to indicate only the professional component of a radiologic procedure? I, TC, B, -26, C, -77, D, -52. Answer, B, -26. This question tests the understanding of CPT modifiers used in radiology to distinguish between the technical and professional components of a service. The keyword professional component refers to the physician's work, which includes supervision of the procedure, interpretation of the images, and the written report. Modifier -26 is appended to the CPT code to indicate that only the physician's cognitive service, the interpretation and report, is being billed. Conversely, modifier TC is used to bill for the technical component, which includes the equipment, supplies, and technician labor. Question 20. Which term is used to describe a congenital absence or closure of a normal body opening or tubular structure? I. Stenosis. B. Atresia. C. Fistula. D. Hyperplasia. Answer B. Atresia. This question tests essential medical terminology, specifically a term related to congenital abnormalities. Atresia means the abnormal condition of having a body passage or opening that is closed or absent. For instance, esophageal atresia means the esophagus does not form properly and ends in a blind pouch. Understanding prefixes, suffixes, and root words like atresia is crucial because coders encounter these terms when abstracting congenital anomaly diagnoses in ICD-10-CM Chapter 17. Question 21. When a patient is seen for the evaluation and management of chronic kidney disease, CKD, due to diabetic nephropathy, which condition is considered the underlying condition for sequencing in ICD-10-CM? I. Chronic kidney disease, CKD. B. Diabetic nephropathy. C. Diabetes mellitus. D. End-stage renal disease. ASRD. Answer C. Diabetes mellitus. This question tests the ICD-10-CM guideline for coding conditions due to an underlying cause, particularly the required sequencing for diabetes-related complications. The keyword due to diabetic nephropathy indicates a causal relationship, requiring the underlying systemic disease, diabetes mellitus, E08E13, to be coded first. Diabetic nephropathy is a manifestation of the diabetes, meaning the primary disease caused the secondary condition. Therefore, the coder must sequence the code for the type of diabetes mellitus first, followed by the combination code that specifies both the CKD and the manifestation of nephropathy. Question 22. What CPT category is used to report services and procedures that utilize new technology and are typically tracked for future inclusion in the main CPT book? I. Category I. B. Category II. C. Category III. D. Category 4. Answer C. Category 3. This question tests the understanding of the different categories within the CPT codebook. Category 3 codes are a temporary set of codes used for emerging technologies, services, and procedures. These codes allow for data collection on the effectiveness and utilization of new services before a permanent Category I code is established. Category I contains the widely accepted, approved procedures, while Category 2 codes are used for performance measurement, like quality metrics, and are optional for reporting. Question 23. A modifier P3 is used in CPT anesthesia coding. What does this physical status modifier indicate about the patient? I. A healthy patient. B. A patient with mild systemic disease. C. A patient with severe systemic disease. D. A patient with severe systemic disease that is a constant threat to life. Answer C. A patient with severe systemic disease. This question tests knowledge of the anesthesia physical status modifiers P1 through P6, which are mandatory and help reflect the patient's condition before surgery. P3 specifically indicates that the patient has a severe systemic disease, e.g., poorly controlled hypertension, history of MI, that significantly complicates the anesthesia plan. These modifiers are appended to the CPT anesthesia code to assign appropriate relative value units, RVUs, for payment. Remember, P1 is a healthy patient, and P5 is a moribund patient not expected to survive without the procedure. Question 24. Which structure is located in the upper right quadrant of the abdomen and is responsible for filtering blood and producing bile? I. Spleen. B. Stomach. C. Liver. D. Pancreas. Answer C. Liver. This question tests fundamental gross anatomy and the location of major organs, which is essential for accurate surgical coding. The keyword upper right quadrant and the functions filtering blood and producing bile definitively identify the liver. Surgical codes are highly dependent on the anatomical location and the specific organ system involved. A solid anatomical foundation allows the coder to quickly narrow down the appropriate CPT section, e.g., digestive system for the liver. Question 25. What CPT code represents the laboratory panel used to report the tests for a basic metabolic panel, BMP? I. 80,048. B. 80,050. C. 80,053. D. 80,061. Answer I. 80,048. This question tests the specific CPT codes for laboratory organ or disease panels found in the pathology and laboratory section. Panel codes like the basic metabolic panel, BMP 80048, or the comprehensive metabolic panel, CMP 80,053, are created to report a set of tests commonly performed together. The individual tests that comprise the BMP, like glucose, calcium, potassium, etc., are bundled into the single panel code. When a panel code is available, it must be reported instead of reporting the component tests individually. Question 26. A physician orders a surgical pathology consult on a specimen, e.g., a biopsy that was taken and submitted during a procedure. Which CPT code category is used to report the pathologist's examination of the tissue? I. 88,300 to 88,399. B. 88,104 to 88,125. C. 87,001 to 87,999. D. 89,000 to 89,999. Answer: I. 88,300 to 88,399. This question focuses on the CPT subsection for surgical pathology services. The keywords surgical pathology and pathologist examination of the tissue point directly to the 88,300 to 88,399 series. This code range covers the gross and microscopic examination of tissues removed from the body during surgery, known as the level codes, e.g., level 1 through level 6. Remember that the level of service, e.g., 88305 for level 4, is determined by the specimen type and the extent of the pathologist's examination. Question 27. When assigning an ICD-10-CM code for a burn, what is the correct sequencing priority if a patient has a third-degree burn on the arm and a second-degree burn on the chest? I. Sequence the second-degree burn first. B. Sequence the third-degree burn first. C. Sequence the burn with the larger body surface area first. D. Sequence the burn with the higher anatomical location first. Answer: B. Sequence the third-degree burn first. This question tests the ICD-10-CM guideline for sequencing multiple burns. The cardinal rule for burns is to code the most severe burn first, regardless of the anatomical location or the size of the burn. A third-degree burn is more severe than a second-degree burn because it involves the destruction of the full thickness of the skin and sometimes underlying tissue. Therefore, the T31-T32 code for the highest degree of burn must be the primary diagnosis, followed by the codes for the other, less severe burns. Question 28. Which component is not factored into the calculation of a physician's payment under the Resource-Based Relative Value Scale, RBRVS? I. Physician work, W. B. Practice expense, P. C. Malpractice/professional liability insurance, MP. D. Hospital/facility overhead costs, HOC. Answer: D. Hospital/facility overhead costs, HOC. This question tests core knowledge of the payment methodology used by Medicare and many other payers, the RBRVS. The RBRVS system calculates payment based on 3 core components: physician work, practice expense, and professional liability insurance, malpractice. This sum of the 3 is multiplied by a geographic adjustment and the national conversion factor. Hospital/facility overhead costs are handled through a separate payment system, e.g., MSDRGS for inpatient, and are not included in the physician's fee-for-service payment calculation. Question 29. The suffix ostomy refers to which type of procedure? I. Surgical repair. B. Surgical removal. C. Surgical fixation. D. Surgical creation of a permanent opening. Answer: D. Surgical creation of a permanent opening. This question tests the understanding of common medical suffixes used in CPT surgical descriptions. The suffix ostomy means surgically creating a new, permanent opening mouth to the outside of the body or between 2 body parts. For example, a colostomy is the creation of an opening from the colon to the exterior of the abdomen. Recognizing this suffix helps coders correctly categorize a procedure, differentiating it from procedures like ectomy, removal, or plasty repair. Question 30. When is a new patient E/M service, e.g., 99202, used instead of an established patient E/M service, e.g., 99212? I. The patient has not received any professional services from the physician or another physician in the group within the past 3 years. B. The patient has not received any professional services from the physician or another physician in the group within the past 5 years. C. The patient has never been seen by any physician in the hospital. D. The patient is covered by a new insurance plan. Answer: I. The patient has not received any professional services from the physician or another physician in the group within the past 3 years. This question focuses on the CPT guideline for distinguishing between a new patient and an established patient for E/M services. A patient is considered new if they have not received any professional services, defined as face-to-face E/M or procedure codes, from the physician or another physician/qualified healthcare professional of the same specialty in the same group practice within the preceding 3 years. Knowing the 3-year rule is critical because new patient codes generally reimburse higher due to the typically increased work of obtaining a complete history. Question 31. What is the appropriate HCPCS Level 2 code for the rental of a standard wheelchair? I. E0986. B. E1161. C. E0990. D. E1031. Answer: B. E1161. This question tests the knowledge of HCPCS Level 2 codes, specifically for durable medical equipment, DME. The E-code range is designated for DME, and E1161 is the specific code for a manual wheelchair with fixed armrests and fixed footrests, commonly referred to as a standard wheelchair. Unlike CPT, which reports services and procedures, HCPCS Level 2 codes are used primarily to report supplies, materials, injections, J-codes, and equipment like wheelchairs. Question 32. The term subluxation is best described as I. A complete dislocation of a joint. B. A partial or incomplete dislocation of a joint. C. A fracture near a joint. D. Inflammation of a joint. Answer: B. A partial or incomplete dislocation of a joint. This question tests medical terminology related to musculoskeletal injuries. The prefix sub means under or less than complete, and luxation means dislocation. Therefore, subluxation refers to an incomplete or partial dislocation where the joint surfaces remain in partial contact, unlike a full dislocation. This distinction is critical in ICD-10-CM and CPT, as the treatment and coding for a partial dislocation will differ from a complete dislocation or a simple sprain. Question 33. Which plane divides the body into front, anterior, and back, posterior portions? I. Sagittal. B. Transverse. C. Frontal, coronal. D. Mid-sagittal. Answer: C. Frontal, coronal. This question tests foundational knowledge of anatomical planes, which are essential directional references in medical documentation. The frontal or coronal plane is an imaginary line that runs perpendicular to the sagittal plane, dividing the body into its front, anterior or ventral, and back, posterior or dorsal, halves. Understanding all 3 main planes, sagittal, transverse/horizontal, and frontal/coronal, is vital for interpreting surgical reports and imaging studies. Question 34. A patient is diagnosed with malignant hypertension. According to ICD-10-CM guidelines, how is this documented? I. A code from the I-10 essential primary hypertension category is used. B. A code from the I-11 hypertensive heart disease category is used. C. A code from the I-12 hypertensive chronic kidney disease category is used. D. A specific code from the I-10 I-15 category is used to indicate the severity. Answer: D. A specific code from the I-10 I-15 category is used to indicate the severity. This question tests the ICD-10-CM guidelines for coding hypertension, which are dependent on the type and severity. Malignant hypertension is explicitly classified as an accelerated, severe form of essential hypertension and requires its own specific code, such as I-10 essential primary hypertension, with a 5th character that indicates malignancy. ICD-10-CM requires the coder to use the most specific code available, and codes in the I-10 I-15 block differentiate between benign, malignant, and unspecified hypertension. Question 35. A surgeon performs an open repair of a recurrent inguinal hernia on the left side. What is the critical piece of information that the CPT code selection depends on? I. The patient's age. B. Whether it is direct or indirect. C. Whether it is reducible or incarcerated/strangulated. D. Whether the hernia is initial or recurrent. Answer D. Whether the hernia is initial or recurrent. This question tests specific CPT surgical coding knowledge for hernia repair. The keywords are open repair and inguinal hernia. When coding hernia repairs, codes 49,491 to 49,659, the CPT selection is fundamentally dependent on 4 factors: the type of hernia, G, inguinal, femoral, the approach, G, open, laparoscopy, the patient's age, and whether the hernia is initial or recurrent. In this case, the keyword recurrent is the most critical factor that directs the coder to the correct subcode category.